Back pain means something is seriously damaged. Is this true?
Definitely not.
Bed rest is the best treatment for back pain. As an ortho spine surgeon, is this right?
To a certain extent, I would say, but when you say back rest, I have seen few people who will come to me who have taken rest for 2 weeks and 3 weeks, which is really not correct.
Exercise will worsen your back pain.
Exercise is definitely going to help your back pain.
Hello and welcome to the News Minute. This is Real Talk powered by Apollo Hospitals, Chennai. And joining me today is Dr. Chetan, ortho spine surgeon. Sir, thank you so much for joining us. How important is spine health?
Yeah, that's the first question you're asking me, and that's a really important question. If you ask me, spine is one part of your body which is bearing your burden throughout your life. Okay, the moment you start walking, it bears the burden of your whole body, and it is going to keep you upright. And yes, so it is very important. Nowadays, because of this sedentary lifestyle, the spine health issues are coming up, and it is becoming more and more important that we look after our spine.
So we are seeing more young people with back pain and neck pain. What has changed in the past decade?
If you see, our lifestyle has changed in last 10 to 20 years, I would say. We have not been working out enough, okay, as compared to olden days where you would be doing a lot of manual work, a lot of labor work. That is not happening. A lot more people are going into sedentary lifestyle, IT sector, desk job, where they are most of the times sitting and not doing a lot of activity. And that has changed. Or the opposite spectrum, either they are not doing anything or they are traveling a lot. So that has changed.
So low back pain has become one of the leading causes of disability globally. Why has it become so widespread?
So the more and more youth is now doing desk job. If you see, if you ask 10 kids around you, they are into, out of 10, almost 7 to 8 are into a desk job. They are having a desk job. They are doing an IT sector work. Okay, they are into banking or this and that. Most of the times they are sitting. If you ask them at work, they don't have anything to, like a activity they are not doing, or even once they go home, they are not doing any kind of activity. That is bringing more and more back pain to these population.
Yeah. Okay. So how much of this is connected to the sedentary, like the modern day spine problems? How much of this is connected to the sedentary work that you are talking about?
So there are these studies where they measure the pressure in the spine in different positions. Okay, so what do I mean by that? So let us say you are lying down. There's absolutely no pressure on your spine. Okay, there are these discs in between your bones. There is very less pressure when you are lying down. When you stand, the pressure obviously increases. But surprisingly, when you sit down, the pressure is even more as compared to standing.
So when you're sitting, it's more. The pressure is more.
The pressure
compared to lying down or standing.
Yes. And the moment you start bending forwards, that pressure increases even further. And the moment you start lifting weight, the pressure goes even beyond. Okay, so I mean, that's an example that, okay, if you are sitting for prolonged period of time, it is going to affect your back.
Is tech neck real clinical concern or just an overused term?
I think it is a very pertinent, to these days. If you ask me, Saturday clinic is full of all the IT sector patients. Okay, so they are coming with all sorts of neck pain and back pain and upper dorsal, upper back pain, and then they have got these tingling numbness in their arms and legs. So yes, it is a significant concern, I would say.
So you talked about Saturday and Sunday clinics.
Yes.
Can you tell us more about that, the kind of patients that you are dealing with?
I mean, if you see that all the IT employees, they're working from Monday to Friday, and Saturday is their day, their free day, and that is the time they would be coming to the clinic. So that's why I tell everybody that Saturday clinic is mainly for the people who are having sedentary lifestyle. They will be coming with those issues.
But posture is something which is often blamed. But how significant is this really?
So yes, definitely, as I explained in my earlier explanation, that when you are having a poor posture, the stress on your back increases, the pressure on your disc increases, and over a period of time, these discs, they start degenerating. Let us say my hair becomes white or my skin gets wrinkles. So similarly in your spine also, the discs are aging. Okay, now obviously those discs should age after the age of 40, 50, 60 or even later on. But nowadays, because of this overusage or over-sitting or sedentary lifestyle, those discs, they are degenerating even after 20 years of age. Okay, so the crowd which is sitting for a long time, they are coming to the spine doctors.
So many patients say that their scans show issues like disc bulges. But how often does these actually cause pain?
Yeah, so nowadays if you see, if you go on a road, you will find at least one scan center. So everybody is advising scans left, right and center. So I'm not saying that it is not needed. Yes, sometimes it is needed. But nowadays if you get back pain, everybody comes to you with a scan in their hand. And every scan is going to show some or the other issue. But that does not mean that that is really relevant to that person. So a lot of times there are findings in the MRIs, but they are not that significant, to be frank.
So treatment related to spine issues, is it only surgery or remedy, or are there any other ways of treating someone?
So if you ask me what is my profession, as I told you, I'm an ortho spine surgeon.
Yeah.
But that does not mean that I operate everybody. In fact, out of 100 patients I see, we end up advising surgery to hardly 4 or 5 patients. Because 95% of the issues can be solved with conservative treatment, conservative line of treatment, which includes medications, physiotherapy, exercises, lifestyle modification, weight reduction, and so on and so forth.
So you talked about lifestyle modification. What is the major cause of spine related issues? Is it stress, sleep, mental health, or what?
They are all interlinked and thus they affect the spine. I mean, I would not be able to tell you exactly how much study wise that, oh yeah, stress affects the back pain and there is direct connection, or if you have stress 50% of you will be having back pain or this and that. Yes, stress leads to back pain indirectly, but there are no direct connection between that. So let us say I'm having back pain, but because of the stress I might feel the back pain more. I might have more perception of back pain as compared to a normal person.
So you must have encountered hundreds of patients or thousands of patients. What is the biggest myths that the patients come up with, when they have back pain or spine related problems?
The biggest myth they feel is that once they go to a doctor, they are going to advise a surgery.
Exactly.
And I am going to undergo a surgery. And the another biggest myth they feel is that once you undergo surgery, you are going to get paralyzed. And that's the biggest concern they have.
That concern is real, right? Like when, I think when you have spine related issues, the first thing that is suggested to them is surgery.
In fact, I would be counter, replying to you about that. In fact, most of the times, as I told, 95% of the times, you don't need spine surgery. Okay, the back pain goes away with a lot of non-surgical techniques. So, yeah, there are at least 8 or 9 different steps before discussing or deciding a surgery.
So, you talked about long commuting hours, sedentary work, poor ergonomics, and limited physical activity. How are these contributing to spine health today, or like reshaping spine health today?
As you said, ergonomics, that's my favorite topic. In fact, I go to a lot of IT companies and I give them a lecture about it. What is ergonomics? What does it deal with? What does it actually mean? And in fact, I'll give you a brief idea. So let us say you are an IT employee, you stay at one place and then you travel, let us say 20 or 25 kilometers, because all the IT sector, all the IT companies, they are located at the far end of city.
Outskirts of
the city, or in fact you are staying in one corner and you are traveling to the other corner because your house and your workplace, they are not the same most of the time. And you see the condition of the roads right now, or even if the condition of the roads, let us say it is good, still you are sitting on your two-wheeler or you're sitting in your four-wheeler or you're sitting in a bus, train, metro for at least half an hour, 45 minutes without any activity, because you are jam-packed, you are not even moving slightly here and there. And movement is needed for spinal health. Okay, so yes, this travel is adding an insult to your spine. So if the travel is bumpy, it is adding one more insult to your spine.
Is there a difference? We are only talking about the urban population. What about rural population? They are not so much into IT work. They do manual work, manual labor. So what is the difference?
Let us say a farmer. So nobody goes and teaches him how to lift a weight. In fact, he's been doing it since he's a kid and an adult, and his whole life he's been doing that. He bends forwards and he lifts a weight without any bending in the knee or this thing. So he is adding injury to his disc every day, and over a period of time it becomes more and more, and that's how it is affecting him. So the problem of a desk job person or a person who has a sedentary life, and problem of the person who is doing a really heavy job, who is lifting lots of weights, let us say more than 20 kgs, 40 kgs, is different. But yes, they end up in the same line.
With same issues.
Yes.
Okay, you said you have been interacting with people who work in IT companies. When you go talk to them about the chair that they sit in, the table, the level, and all of it, like, what is the response? Like, are there more questions after questions, or how is it? Or are they surprised, or are they saying, like, they are like, we are fine, it's okay, this is our life, this is our work?
So of course you would be knowing this, that these are the people who consume maximum amount of information which is available online. In fact, they have so many questions that if I start telling them that if you have neck pain, do this and that, they will start asking questions that, oh, is this pillow good, or is that pillow good, or is this company good, or what kind of mattress should I buy, or what kind of a chair should I buy, or how should I sit, do I take a normal desk or do I use a standing sitting kind of desk, and they have a number of questions. In my opinion, most of the information which is available online, in fact most of the things they have been advertised that if you use this kind of pillow or that kind of pillow, your neck pain will go away. I feel most of it is a marketing technique, a gimmick, and I wouldn't say that they are bad, but they are not helping too much either.
The usage of smartphone, especially among young Indians, how is it affecting spine health, sir?
So if you see in fact, let us say you sit in a metro and you are traveling, if you see 90% of the people around you, they are really submerged in their phones. Okay.
Even journalists are. Like,
yeah.
All our life, our job is like with the.
Yeah. So earlier you used to open your newspaper and you would read the news, and now you are opening your smartphones and you are reading your news. Okay. So the information which was on the paper or in the books has gone in your smartphones or devices. Okay, so definitely you are bending forward. So every degree when you are bending forwards, it is adding some insult to the discs inside your neck.
So that's a cause of concern.
Definitely. In fact, when you are holding a phone, it is not only affecting your neck, it is affecting all the joints of your left hand as well. Okay, because they are not in proper position. Okay, because you start seeing your mobile, and then over a period of 5 minutes, it just drops down and takes the position of ease. Okay, because your neck doesn't have to work in this position. Your muscles are really relaxed. Okay, and that is adding insult to your discs in your neck.
So what is the remedy? Like, how do we prevent this, or like, should we cut down the screen time, or what do we do?
Definitely. You yourself are giving me a solution. In fact, everybody knows that they have to reduce their screen time. It is not only affecting their necks, it is affecting their eyes. The power is changing, and then they have to strain to go closer to or away from the screen, and in fact that also is popping their neck in a wrong direction and adding insult to the neck.
From avoiding certain things to treating something on their own. Like in Indian context, people are used to doing home remedies. If you have a back pain or a spine pain, lower back pain or something like that, they do home remedies. How does these home remedies impact the real outcomes, like after a medical intervention?
As I said, most of the back pain will go away. In fact, if I ask this question to, let us say, 100 people randomly, in fact 80% of them would say that they have experienced back pain in their life at least once. But how many times they have actually gone to doctor? Probably hardly 5 or 10 of them would have visited doctor. Because most of the time that back pain is not very severe, or it is self-limiting. What do I mean by self-limiting is that it just goes away. Okay, there is muscle spasm, you give adequate rest and the back pain goes away. In fact, most of the scenarios you don't actually have to see the doctor. Okay, so that pain goes away with rest. So if you take, let us say, adequate rest, which is approximately 24 to 48 hours, okay, and the pain just goes away.
So you also talked about people consuming a lot of information online, but all the information that is available online, whether it is right or no, is something which people tend to believe in different ways. Here are some online myths, and I'll ask you one by one, and I would want your response on that. As an ortho spine surgeon, back pain means something is seriously damaged. Is this true?
Definitely not. In fact, as I said, most of the times the back pain is just pure paraspinal muscle spasm. Okay, your muscles, let us say you go for running and you have calf cramp, you take rest, you drink adequate amount of fluid, and the calf cramps, it will just vanish. Okay. Similarly, you do some kind of abnormal activity where you're not supposed to lift weight, or you have sat for a really long duration without getting up, your paraspinal muscles will go in spasm, you take rest and it will become all right. Okay, so most of the times back pain is not serious.
So if you Google saying I have back pain, what do I do? Then Google throws up some remedies, right? Bed rest is the best treatment for back pain. As an ortho spine surgeon, is this right?
To a certain extent, I would say, but when you say back rest, I have seen few people who will come to me who have taken rest for 2 weeks and 3 weeks, which is really not correct. In fact, if you see the literature, a maximum amount of 48 hours of rest is enough. In fact, it is detrimental onwards. If you are taking too much of rest, it is not good for your spine health.
So too much of rest is also not good?
Is definitely not good. 24 to 48 hours rest is enough. After that, your back muscles, they start losing their health. And indirectly, your nutrition to your bones and the discs, it comes from movement. The more you take rest, the nutrition won't reach to your discs and bones, and yes, in long run they will also have issues.
So slip disc always needs surgery.
In fact, it's a biggest myth. If I see 100 reports, maybe 80-90% of them would be having slip disc. Okay, but that does not mean that it requires surgery, unless it troubles them so much that without the surgery they're not going to get better. An ortho spine surgeon will not advise a surgery, and out of maybe 100 slip discs, maybe 3, 4 or 5 of them would need surgery.
So perfect posture will prevent all spine problems. As someone who is an expert specialist on spine health, do you agree with the statement?
No, I disagree. In fact, I would suggest that you need a perfect posture, but we are not robots that we are going to be in one posture forever. Okay, we are going to move. Okay, in fact, movement is life. Okay, so if you don't move, again, as I said, your spine is not going to get enough nutrition. Your bones, your discs, and the tissues around them, they are not going to get enough nutrition. Okay, so a perfect posture is what you want to have most of the time, but you're not going to have it 100% of the times. So yes, you have to keep on moving. So let us say an IT employee who is coming to me, I tell them that you take a small break of 2 to 5 minutes after every 45 to 60 minutes. So they are sitting in front of their computers, their screens, they're working. So after every 45 minutes or 1 hour, they get up, they do some kind of small activity,
stretching.
And they stretch their necks and their backs and their arms and their legs, and they sit, or they take a small walk and they come back and sit. That is needed, that is required.
If your MRI shows a problem, that's the cause of your pain. This is one of the online myths.
So as I said, tooth is moving, or let us say your hair has become white, or your skin has got wrinkles.
It's already become.
Or these are the things which are going to happen over a period of time in every individual. So if you see MRI, they are not going to be different. Even MRI, inside the MRI, there are going to be some issues which are going to be seen, but that does not mean that that is the reason for your back pain.
So one more online myth is exercise will worsen your back pain.
Exercise is definitely going to help your back pain. In fact, when your back pain is very severe, we tell patients not to do a lot of exercises. We tell them to take a rest. Once they recover from a stage of severe back pain, we ask them to do some basic activities like simple walking and then we keep on adding one exercise to their regime, and that's how they improve their spinal health.
So they don't need to do intense workout.
A simple-
That's something that they can avoid.
Yes, they should avoid intense workout when they are having severe back pain, because that will add insult to their the issue which they are already having. It will be, the insult will be added to it.
Okay. So one more online myth is back belts and supports fix spine issues. So there's no need for an ortho surgeon.
Absolutely not. In fact, nowadays, if you see, there are so many upper back belts are available,
Yeah.
which they tell that if you wear them, your posture will improve. And when they are
The-
stooping
your hunch-
forwards, when they are hunching forwards, that it will become all right. So yes, on day one, it will become all right. But then the muscle which they have to develop to keep themselves in that posture, they are all relaxed, and they are becoming thinner and thinner, and they are not able to support they will not be able to support their back in future. So yes, they are not good in long terms. Maybe in short term they are good, but they should not be used over a prolonged period of time.
No, but it's easily available on Amazon. Like if you or even on your Instagram, it comes as a reel. So if you just like watch this for a few seconds, then this keeps coming.
So that's not good.
That's
actually.
not good.
Definitely not good. If you keep wearing those belts for a really long time, you will develop something called as muscle atrophy, or in simpler language, your muscles will reduce in thickness and in power. Okay, they will not be able to hold your own weight. So that is definitely not good.
So what is your suggestion to people who get carried away by these ads? Like first we had Google as a problem. People go Google and find out. Now we have Amazon that's throwing up ads. Like you get this belt, you get this strap that that'll make you feel better. So what is your suggestion? What is your advice?
I think they should seek help of a doctor, preferably a spine doctor who is trained in treating spinal problem once the severity of their back pain or the duration of their back pain goes beyond a certain limit. So let us say you are having a back pain which is not getting controlled with, let us say, 2 to 4 days of rest, and then it is not getting controlled. Or it is just going on increasing. That is the time you should seek a doctor's help. Okay, and they will advise you what is needed. If you keep wearing those belts, definitely you will feel better, but that's not the solution.
So in other words, what you see on Amazon or what is suggested to you on Amazon on Instagram Reels is not going to help.
Definitely not.
My last question, or the one online myth, only older people get spine problem. Is that true?
See, most of the patients, they are old, and as I said that most of the issues, they are age related, but you would be surprised the amount of younger individuals I see nowadays having these back pain and back issues, that it is really mind boggling that they come with their parents and they are surprised, oh, he's only 20, doctor, how come he has this issue? But yes, we have been treating these back problems even at the age of 15, 18 and 20 as well.
What is the reason, doctor?
As I said, that they are most of the times sitting. There is no adequate time given. Let us say I'll stop myself in between and I'll ask you this question. When you were younger, what did you do when you were not studying? You would just go out, you would be playing and you would be enjoying. Nowadays, if you want to go out and be on the road and play, that's just not going to happen. Okay, so you really have to take off time and go to some designated park or a place where you go and play. That is not happening. So most of the times the kids, they are literally sedentary. So yes, that is the one of the issues, that they are having back problems.
Right, doctor. Thank you so much for talking to us and giving us your insight on such an important topic. Thank you.
All right. Thank you for having me here. Thank you so much.